So here are 8 important things you should not miss out telling your anesthesiologist before surgery. So as physicians, we are not here to judge you based on your habits, but we want to provide you safest and most effective anesthesia. So first thing, tell us if you are taking any medications or any supplementations, and it could be for any purpose, whether the medication can be allopathic, ayurvedic or homeopathic. And the second thing is smoking. Tell your physician if you have a history of smoking, because smoking damages your lungs and heart, and it can cause breathing problems during or after surgery. And third thing is marijuana. Usage of marijuana has a most significant risk as that of cigarette smoking, and it has a sedative effect and it can interact with anesthetic medications. And the fourth thing is drinking alcohol. If you're taking alcohol, like more than 2 drinks per day, it will increase the risk of complications of anesthesia also significantly. And tell your anesthesiologist about your alcoholic history. He will advise you to stop alcohol or abstinence from alcohol for few weeks before surgery. And the fifth thing is snoring. Snoring is usually caused by obstructive sleep apnea, and the patients with sleep apnea have a difficulty in regaining in consciousness after surgery. So your anesthesiologist is going to change the dosage of the sedative medication accordingly. So it is important to tell him about this. And the next thing is heat stroke. Tell us if you ever suffered from a heat stroke, because your body is unable to regulate heat, and you can land up in a potentially dangerous complication which is known as malignant hyperthermia. So you are at this risk, which can cause high grade fever and muscle rigidity during surgery. And the next important thing is, have you ever had an exposure to anesthesia? If yes, then have you had any reaction? Because these reactions can be recurring and they can be life threatening and dangerous. And lastly, tell us if you have any chronic health issues like hypertension, diabetes, thyroid, asthma, epilepsy, then stroke, cardiac conditions, or any neurological conditions, because we are going to optimize you and prepare you for surgery, prepare your body for surgery, and also we are going to reduce your risk of surgery and anesthesia related complications. As a final word, your safety is our priority, and your full disclosure of information is going to be the key for safe anesthesia practice.